So first thing I'm going to do is verify that the provider ordered an enema, which there is Osat's enema ordered, and if it was a medicated enema, I would check against the MAR to make sure it's the right one. So now I can go and gather my supplies and head into the patient's room. So knock knock, set things down, hand hygiene. So hi, my name is Amy and I'm your student nurse. Today I'm going to be administering an enema. Before we begin anything, I'm going to have you verify your name and your birthday, please. Thank you. Do you have any known allergies we should know about? No? Okay. So today I'm going to be administering an enema. This is just going to help you relieve constipation and have some bowel movements. Okay, so do you have any questions or concerns before we begin? No? Okay. So I'm going to provide patient privacy and I'm going to raise the bed to working height. And now that my things are set down, I'm going to prepare my enema kit. So I am going to make sure that it is clamped. And then I am going to administer my 200 milliliters in my graduated cylinder of warm water. I tested it by putting it on my wrist and making sure that's not hot water, or else warm water will help to minimize cramping. So I'm just gonna add my water. Okay, and so now I am going to add my Castile soap concentrate in there. Okay, and so now that I have filled up my enema bag, I am going to unclamp to prime it. And this is going to help to get rid of any air bubbles or an air in there. Okay, so now that it's primed, I'm going to set it down. And so now I am going to have the patient, I'm going to lower the rails, and I am going to have the patient be in sitting position. I'm going to make sure that I put my waterproof pad right under them, right under the area. And then I am also going to utilize a blanket to help provide modesty, and just to cover them up besides their buttock area. Okay, and so now that I have done that, I am going to put on some gloves. I'm going to make sure that a bedpan or commode is readily available right next to the patient, or that and if the patient is able to ambulate, I'm going to make sure that the restroom is also readily available. So I have my commodes right here. So now I am going to be letting the patient know that I'm going to be touching their buttock area, and I'm going to be assessing for hemorrhoids, anal fissures, erectile prolapse. So I'm going to be putting my hands on you, and I'm just going to be spraying it and looking. And there seems to be none, so we are okay to continue with the procedure. So now I'm going to lubricate the tip of my tube. Okay, so it's been lubricated. Okay, and so now I'm going to grab my enema bag, and so I'm going to let the patient know. I'm going to let the patient know, can you take some deep, continuous, deep, slow breaths, okay, throughout while I'm doing this procedure, okay? This will help things feel not as uncomfortable, okay? And so now I'm just gonna take off the tip, and I'm going to put it 3 to 4 inches into the, I'm gonna locate the anus area and insert 3 to 4 inches towards the umbilicus area. So, and if I feel resistance, I'm going to stop, but I do not, so I'm going to continue inserting. Okay, and so now that it's been inserted, I'm going to hold the enema bag at their hip level, and I'm going to unclamp and let the solution flow. And so once this continuous flow has been established, I am going to hang it on an IV pole. Okay. So while the enema is being added in, I am going to check that there's no discomfort or pain or resistance, and if there is, I would stop the procedure. If there's any cramping or then or any residual fluid flowing out, I would either lower the bag or I would clamp it. And so now I'm just waiting for the solution to fill. Okay. And so now that the solution is finished being filled, I'm going to clamp it. And I'm going to advise the patient that they should try to lay in this position for 5 minutes with the solution in them, or as long as however long as they're able to. I'm going to advise them that mild abdominal cramping or bloating is normal, and when you use restroom, to not flush the contents because they need to check the bowel and the solution characteristics. And so now the solution is finished being emptied, I am going to use tissue paper, and I'm going to let the patient know that I'm touching your buttock area and I'm going to be taking it out. I'm going to gently withdraw. Okay. And so now I am going to dispose of the enema kit. And I'm going to dispose of my gloves. And I'm going to cover the patient. And so this, now I'm going to wash my hands. And so if the patient needs assistance with using the restroom, I would help the patient use a restroom, and I would help them settle back into their bed. And if this patient needs assistance with rectal care, I would help them to, I would apply new gloves. And I would help them assist and clean up the area. Then I would take off my gloves and throw in the trash and hand wash again. Okay, and then I can check the stool characteristics in the solution. So, and I would note these findings later after I'm done doing this procedure with the patient. And so now I'm going to let the patient know that the procedure is done. I'm going to lower their bed, raise up the rails, and let the patient know here's your call light. Let me know if you have any questions or concerns at any time, okay? My name is Amy, I'm your nurse, your student nurse. Thank you for cooperating. Hand hygiene, and exit the room.